transition.
Matt and Grant back there?
No, that's fine. That's fine, as long as they're okay. I think they are. Yeah, I guess it's nice. I don't know.
Now Grant will go to medical school this fall, and then Matt, just took a,
Yeah, yeah. Yeah, I would be too.
I don't know.
Yeah, you guys can turn the lights on and come up front if you want.
We did the master Chairperson.
That's your call.
We can,
Yeah, you guys.
once we got seated, we can, that's up to you, the board.
I'm gonna keep mine on, but you all can take it off. I'm just used to it.
Yeah, you make me a sign one here?
Good afternoon.
I forgot it.
Okay.
We're ready.
Would we please call the meeting to order? Could we rise for the national anthem?
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Rhonda, could you call the roll, please?
Dr. Turner,
Present.
Jeff DePass,
Present.
Dr. Lim, Dr. Caddick,
Present?
Dr. Ross, Dr. Todd,
Here.
Mr. McCanna,
Present.
Dr. Brucken,
Present.
Joni Wise.
Present.
Minutes of the last meeting, an action item. Is there a motion to approve the minutes?
Now motion.
Is there a second?
Second.
All those in favor of approving the minutes, say aye.
Aye.
Opposed? The minutes are approved, the last meeting. Rhonda, the financial report?
It is not available yet. We're still ending the year, starting the new, encumbering. Yeah.
No concerns?
No, I don't think so.
No, just the normal headache of rectifying last year's accounts and starting over.
Move on to the health officer report. Dr. Brucken?
Yep, thanks. Obviously, it's been business as usual around here with the COVID response and with all other things health department related. So I know I'm a broken record, but each time I get this opportunity, I like to thank all the people doing the COVID response. I see a few of the tracers and things here. So it's a constant process of evolution with what we're doing and trying to respond to things, and obviously keeping an eye on what's going on in not only this area, but the state and the Midwest. Omicron is now obviously rampant, and it has changed our treatment modalities, it's changed our hospitalization landscape, and continues to be in flux. So we've seen no higher caseloads than what we've seen here in the last few weeks since the onset of the pandemic. So it's the work is certainly not done, unfortunately. And I just, every time I like to tip my cap, my proverbial cap, to everybody doing their job here every single day. So it makes us certainly look like we know what we're doing, which is great. I'm also going to give it back to Dr. Turner here as well. Just wanted to recognize the passing of a friend and a colleague who was a great friend of public health for decades. And I'll give it back to Dr. Turner on that.
We're just going to take a moment to recognize Dr. Randy Stevens. Many in this room may have known Randy. A Terre Haute native, came from a working class union family. After high school, Randy enlisted in the United States Army. He trained as a combat medic where he served in Vietnam for nearly a year. When he was in Vietnam, he also cared for soldiers who were addicted to heroin. Near the end of the war, heroin was quite cheap, and it became quite an issue. And after Randy first learned to understand about addiction disease, and he carried that theme all through the rest of his 30-year career. Following his service in the military, he enrolled in Duke University's physician assistant program. We had to put up with him wearing that nasty Duke cap every Final Four year around. Those Big Ten guys hated it because Duke was always winning. And then Randy went to work at Hamilton Center, where he got involved with addiction programs there as a physician assistant. And then went back to school and was accepted at IU School of Medicine and graduated from there. And Randy and I met in residency. I was 1 year ahead of him at the family medicine residency in Terre Haute. We became rapid friends really almost from day one. We just had very similar backgrounds and so forth. And we've been close friends those 35 years. Randy became part of the faculty at the residency, and then he became the director for 8 years. Under his tutelage, there were over 150 physicians graduated under his leadership. Not only did he train them in the science of medicine, but especially he was good with the art of medicine. No one was better at the bedside than Randy. And when a student couldn't figure out what was wrong with a patient, he did not tell them to go order more tests. He told them to go back upstairs, put your chair at the bedside, get the history again, do the patient's physical exam, and the patient will tell you what's wrong with them. And that's how these residents were trained. Of the 157 doctors he trained, 157 doctors passed our national board. He took care of the science as well as the art. When you look at Randy's CV, I've never seen anybody who was on more committees or boards than he was. And it was really kind of amazing. It's almost just never seen it before. But when you look at that, the reason was if you had a project that concerned the poor, concerned those in need, Randy would join your committee. He would join your board. He could not say no. And when he joined your board, others wanted to join the board. Once you told them Dr. Randy Stevens was on your board, others wanted to be part of that also. Because Randy's medical ethics and his compassion was unquestioned. And what would happen in that board, your project would go to fruition. It would be finished because Randy was there to help. He was a great leader, a great collaborator. If he got in your committee and in your group, he pulled people together, and it always worked out. We worked together, a great deal together at St. Anne Clinic, which never would have happened without a Randy. But Sister Connie called Randy and said, we're forming a committee. How can we help the uninsured with medical and dental care in our community? And that was the nidus of St. Anne Clinic. I first heard about St. Anne Clinic sitting in the back row of St. Anne Church one day, and not that I was a regular attender, but sometimes providence happens. But I was sitting in the back row, and Sister Pat got up to speak about forming a new free clinic in the 110-year-old Catholic grade school building next door. I was sort of intrigued by that, so afterwards I went up and gave her my name and phone number. I found out later that Sister Pat had been a Navy nurse before she became a sister. And for a year, she served on a hospital ship that sailed along the coast of Vietnam. And of course, the Viet Cong had no Navy. And so when battles broke out anywhere in the jungle, the hospital ship would sail as close as they could to the shore, and they'd bring the boys out all day. He did that for a year. Saw a couple pictures of her with a bunch of nurses sitting around after surgery, all smoking cigarettes, you know. So she was pretty tough. So after I gave her my name and address, she called me the next day and said, well, what kind of time can you give us? I said, well, sister, Tuesday afternoon is my afternoon out. We're starting next Tuesday afternoon. And that's how it happened. We had nothing. No exam rooms. This was a grade school building. Curtains, but it began to grow. People lined up in the parking lot. Volunteers came. When you work with the Sisters of Providence, people volunteered. One time we had over 200 volunteers. It just grew. We grew to the point that we needed a full-time person. So it's kind of funny, Randy and I, hope I'm not boring anybody.
No, not at all.
Randy and I and several of the sisters met with Dave Dewar, who was the CEO of Union at that time. And so Dave said, sisters, what can I do for you? And I said, well, we understand, Mr. Dewar, that we really need a full-time person here. Would the hospital consider donating a nurse practitioner to St. Anne Clinic? And Dave said, well, that won't be a problem. Is there anything else I can do for you? And Randy and I just looked at each other. We should have brought a list, you know. But it just happened like that. So we had Karen Smith, who served us for 15 years. So things just continued to grow and so forth. We had found out that Senator Donnelly was coming to Terre Haute, so we invited him to the clinic. So he and I and Randy and Sister Lawrence Ann met, and he told Sister Lawrence Ann, I want you to know, sister, I was raised by the Jesuits since kindergarten, and I went to Notre Dame. And she said, you're okay. So we told him we were beginning the process of becoming a federally qualified health center. We'd just gotten too busy. And the Affordable Care Act actually had extra funds for a new community health center. So it was a 160-page application to do that process. And the senator said, when you're ready, notify my office for a letter. So when we got done, we called his office, and within an hour, a letter arrived from his staff supporting our project. And 2 weeks later, a check came in the mail, $750,000. And that's how it happened. So it wouldn't have happened without Randy. So he touched many, many people. He really created the addiction programs that happened in this community, changing addictions from some moral weakness to a disease that could be treated. He ran a detox center. He ran the programs. So there's hundreds of people who are alive just because of his care of addictions. It's a really pretty amazing person. Regular kid, grew up on the avenues, and had a remarkable life. And I'd like to give him a moment of silence, if we could. Thank you. Okay.
Thank you, Jim.
So, sorry, everybody. We were friends for 35 years, so. Anyway, let's go to new business. I guess we'll start off with the election of the board chairperson. Do we have nominations?
I'd like to nominate Dr. Turner.
Thank you. Any other nominations? All those in favor of that nomination, say aye.
Aye.
Opposed? Thank you.
Thank you, Dr. Turner.
Best. And now we need to select the vice president. I would like to nominate Jimmy McCann. Are there other nominations? All those in favor of Jimmy's nomination?
Aye.
Opposed? Congratulations, Jimmy. Thank you.
Thank you, thank you.
Congratulations, both of you.
Well, that was okay.
That was easy.
I hate to say, I've had people texting me all week about Randy. TV, the newspaper, and I just got a text from Congressman Larry Bouchon.
Oh, wow.
His spread was so broad. Can I tell one more brief story?
Please
If you
do,
don't mind?
please do.
Randy and I were in San Diego at a conference with our wives and so forth, and there was a young naval officer there named Dr. Tom Catini. Tom was an amazing young man. He was an all-academic football player at Brown University, Ivy League. Graduated from Duke University, the #1 medical school in the country. Was a naval officer, and he was looking at family medicine, for instance, because Tom wanted to be a missionary. His brother was a priest. That was his whole goal. And Randy and Jim Bucher had set up on a residency program a few years earlier, something very few had done in the nation, but training rural family physicians also to do colonoscopies, EGDs, and C-sections, so they could better serve the rural areas. So Tom was looking at a program where he could learn these procedures that he could take with him in his missionary. So we met with Tom and had dinner, very impressive young man, obviously, and he came to Terre Haute, went through the residency. Tom, after that, he went to Kenya and worked in a Mother Mary Missions Hospital outside Kenya, a Catholic hospital. If any of you know much about Nairobi, there's an area called the Nairobi slum, or the Kibera slum, probably 300,000 to 400,000 people, probably 6 or 7 miles from downtown, no running water, no electricity. But Tom took care of the people from that slum served by his hospital. He got a calling about 15 years ago, and that's how he describes it. Tom got a calling to go to the South Sudan, one of the most dangerous war-torn places still today in the world. They were going to build a small Catholic hospital and wanted him to come and start. So Tom went to the South Sudan, dangerous place. They got bombed several times. Their supply trains would get attacked. All the wounded would come to his hospital. Tom had learned here and through different surgeons around the world who came to do all kinds of surgery, amputation. He could do everything. He was the only doctor there, serving 300,000 to 400,000 people. He trained his own staff. His anesthesiologist had a fourth-grade education. Tom's there right now, on the Sudan, on the equator, 100 degrees every day, doing that work. 2 years ago, Tom was awarded the Aurora Award for International Humanitarian Service, a $1 million award. Most feel that that award is second only to a Nobel Peace Prize. Our guy could win a Nobel. Randy brought him here. So he's out there today serving the world, trained by this kid from Terre Haute. Most people don't know that story, but it's
Thank you, Dr. Turner. Very cool.
I feel so privileged to have,
Yeah.
in my 25 years, to be taken back on memory lane of so many of these things that, and names that I've forgotten about, and the inception of St. Anne's and what it looked like and everything. So thank you.
my pleasure. That's sort of difficult, sorry. Donate the annual report, please.
Oh, it's that terrible time of the year. We have to publish our annual report 90 days after the first of the year, as per Indiana code. And one of the things that I'd like to start including again are photos of our board members. So I might be darkening your doorway to get a snap of you unless you want it done tonight. We can but we used to do that, and I'd like to recognize our board again in that fashion. But it's a compilation of all of our programs, our finances, in a nutshell, what we've done in the past year, in 2021.
Anything else? We'll go to old business, COVID-19 response. Brent and your colleague, Matt.
And if you want to take your mask down for,
Okay.
yeah, yes.
So, since the new year started, we've had 3,762 cases, and we've noticed an uptick after the holidays, and since college and students have been back for break. We've been averaging 250 cases plus a day since Christmas Eve. And since the new CDC guidelines have changed, we've been having like a tough time of contact tracing because it would take 3 to 5 days for people to get the results back. And then by the time we call them, they have like 1 day left of quarantine or they're done with the quarantine. And then we've noticed a uptick in long-term care. Both staff and residents are popping up positive, and the majority of residents and staff are vaccinated, and nursing homes are running out of rapid tests, so they're having a hard time doing their weekly testing for their staff and residents. And then another issue we're having is their fairgrounds. They're doing PCR testing, and they've been advertising that people will get the results within 48 hours. Usually it takes them like 3 to 5 days, and we've been getting like a bunch of calls with the health department, and they've been looking for their results. So also the test results that they show to people have been having a hard time like reading it. So so they will call us and ask if they're positive or not. So like they get confused with like what they get.
Tell us more about that. Is it a card or
No, it's like
email?
Yeah, they get an email of a card, and
It's confusing?
yeah, it has like 3 tabs. So it'll say on the right side it's reference, then something else in the middle, then on the left side it's what your test results are, and it'll say underneath those 3 tabs detected, something else, and then not detected. And most people don't know what that means because it says detected and not detected. And then the difference is the way they've decided to do it is if you're positive, if it's red, it says detected, and you're negative, if it's black, it says not detected on the left side. So we get a lot of people that think they're negative because it says not detected on the right, positive.
So this
Yeah.
is a state issue?
Yes.
These are-
It's Gravity Diagnostics, which is contracted through the Indiana Department of Health.
So is somebody going to, looking at that, or?
As far as our site in Vigo County, we give them feedback on what we're hearing. And in fact, I got an email from Doreen this morning about a particular for Dr. Hoineke, about a particular situation that she wants addressed. But it's something that absolutely needs to be fixed.
Yeah. Joni, can we give them feedback too? I've heard from some people who manage the convenient care that when they shut down, convenient care gets like an onslaught
Oh, yes.
of tests. I mean, of course, and then they're not staffed necessarily for it. So it'd be
Right.
nice if there could be some, I think we're trying to get communication, but maybe at the state level, we could let them know that too.
Sure, that they need to reach out and give contact information for Gravity Diagnostics or for this site for the convenient cares. But yes,
Yeah.
one day when they ran out of supplies, they had law enforcement there, and they told them to go to the Walgreens, and then Walgreens called us upset. And I understand, because a lot of people think that it's our testing site, and
Right.
it's not. But I'll be that messenger.
Thank you.
Yes. Matt, will you share with them how many were in Red Cap today from long-term
Oh,
care?
yeah, so today we had the 88 red cap. It's like 50-50 staff and residents. Most of them are vaccinated, but yeah, we had a lot from Westminster and South.
So breakthrough infections, basically.
Yeah.
Yeah.
There's,
Fully vaccinated booster.
there are three long-term care communities right now in the area that are no longer taking patients. They're on freeze until the 25th of January, just because of COVID outbreaks, which is hurting us at the hospital. We can't place anybody.
Yeah, and Westminster had a problem like I think it was last week, where their staff, it took a PCR test, but it took their staff it took them like 8 days to get the results back, and some of the staff didn't show any symptoms, so they worked, and then started showing symptoms, and then that's how Westminster got the outbreak, because they got the test results late. I talked to them, and they said that this is the first time that's ever happened to them, and that they're trying a new lab to work.
So they were doing antigen screening on everybody, and then if you're positive and asymptomatic, you're allowed to work while your PCR is coming back. And they would get the PCR in 2 to 3 days and confirm that that's a false positive because of no symptoms. But by the time they would develop symptoms and then go off work, then their PCR would come back on day 7 positive. They've already been there for 3 days, potentially infectious, so, which is
I
rough.
wonder why we can't get the state test back quicker. I mean,
I don't know. I don't
My
know.
guess is just
Is that-
my guess is just the volume of tests they've
Yes.
had recently. They're getting so many that it's taking much longer than they had originally thought it would take them to get results back to people.
So what have you gentlemen and your colleagues learned about Homo sapiens in general?
Well, with
They're
the
not
new
to be
guidelines,
trusted.
everyone knows that it's a little subjective, and it says if you're better, you can come out of quarantine on after day 5. So every time I ask someone how they're feeling, they're saying, "Oh, I'm much better." So they all know those rules, and they're ready to come back.
So you're working as a contact tracer is going to help Grant when he flies off to medical school this fall, because he's had a crash course in human behavior and how to report it out. So
And then they lie.
yeah.
So, there were issues in the front page of the paper a couple of weeks ago about how we're going to continue to fund you or not fund. What's the final, where are we at?
So it's, I can speak to it kind of vaguely, but we came together with an immediate agreement to keep things as is until we work through the next council meeting. And we've got an appropriation request already submitted and a plan submitted to carry us forward through the first quarter with a very well thought out and devised plan. We probably will be falling more in line with the rest of the state as we move through. But everyone understands the paramount importance of the COVID response in Vigo County. So, and everybody, all the people on the council that we spoke to and the commissioners are all very much on board with continuing to support it in a fiscally responsive manner, so.
Are there any guidelines from the state about requirements about maintaining the contact tracers?
So we have a duty to continue to report communicable disease and reportable diseases. We also have a charge directly from Dr. Box to continue to track and trend all of the Department of Education across all levels, and also long-term care and any congregate housing situation such as the Department of Corrections. So, plus we have to maintain a presence in the community to be a resource for all questions that come to us, whether that's from residents or businesses or other enterprise. So that is our minimum requirement from the state of Indiana. And we do that and some right now, which is great. We've been blessed with these young people that have jumped in. Well, not just all young people, everybody that's jumped in. So, and then we'll see as we move forward how that adjusts and falls into line. Not every county has been as good as we have been. I will put it that way. And that's for a variety of different reasons, but we're certainly proud of the work that we've done to this point, and the job that they continue to do.
Can I ask just one more question? Because I think unfortunately, sometimes the response to, oh, they got the vaccine and they're positive anyway. Is there a difference with the long-term care in deaths with people being vaccinated and boosted?
We've only had one death in long-term care. I was a resident, but I haven't noticed really a lot.
And that's something maybe Brooke can speak to when she gives vital
Okay.
statistics report. And I also wanted to recognize Linda Deckert. She's our contract registered nurse that's been administering the COVID-19 vaccine, and she's been a clinical nursing instructor for many, many years. Thank you.
Thank you.
Thank all of you.
Yeah, I can kind of speak to what we see in the hospitals is the ones that are sick, even breakthrough cases, they are by far and away unvaccinated and non-boosted people. So I do have at least one right now at my hospital, at Regional Hospital, that's fully vaccinated and boosted and sick. But we have seen definitely a severity scale fall off tremendously for people that are vaccinated and boosted, plus the ones that have received monoclonal infusions in the past. Now, Omicron, unfortunately, does not fall into the category of being able to be approached by the monoclonals that we've had at our disposal. We now have a new monoclonal that actually has some activity against it. But the Regeneron that we used for so long has no effect against Omicron. So now we're ramping up other treatments. And fortunately, Omicron has seemed to be a little bit less severe across the board, particularly in vaccinated people, which has been a godsend.
And I think Darren would agree, what's sort of interesting is when people are tested positive, they're more than happy to get the monoclonal antibody treatment. Even though it's experimental, more experimental than a vaccine. We've given many more vaccines worldwide, monoclonal antibody treatments, but would refuse a vaccine, but will happily get in line to get that monoclonal antibody, even though they're both experimental and come out of the same industry. It's sort of interesting.
Absolutely. Yeah, the messaging to get everybody vaccinated and booster really should not be louder than what it is right now. I mean, we need to be screaming it from the rooftops. Definitely the way through the rest of this. So.
Anything else for these gentlemen? Thank you for all the
Thank you, guys.
If I could remind everybody to please speak into your microphone so that it can be heard clearly.
Shall we go to program updates? Nursing? Chelsea?
All right. Okay, so you have our report. Basically, we're working on getting back to our new normal in the clinic. Between the COVID vaccines and school exclusion letters, we've seen a lot more, an increase in patients compared to, of course, being shut down for COVID and everything else. TB testing to be coming back. There was a little lag in closing down and then reopening, finding out that we're back open to taking TB tests. And that's just settling back to our new normal. And then you've got,
And then I was going to give you an update about our Back on Track that we did with MedWise. It went really well. We gave, let's see, where was it? 172 shots to 68 people in 4 hours, which was a lot. So a lot of the community showed out. It was a really good day, weather-wise, and so we had a very good turnout. And there were some news stories on it, and I've just printed out one of the stories from Tribune Star.
It was awesome. Awesome event.
So we really haven't seen much flu. We thought we were going to see some flu early on.
Thank you.
Right.
Sort of. You guys haven't seen much flu A was what I was seeing more.
No.
Really taken off this like the last 2 years. You, Jimmy, seen much flu A?
I don't think so much at all. They're still testing for it in the ER. I don't see much of it.
And we had a couple of cases of Giardia.
Interesting.
Interesting. I wonder, any investigation of that where people traveled overseas or well water or anything about
Hike in the mountains.
well, I usually do the
Yeah.
Giardia one.
the Giardia, Giardiasis?
I'm sorry, I was not hearing the whole question.
I'm sorry, there were a couple cases of Giardia, Giardiasis, it's infection, GI infection, and.
Yes, there's been a
just
couple of
wonder,
those.
Sometimes overseas travel or the mountains.
I don't remember if
Let's see
we,
if they are.
if we found the actual determination of where they got it from, but it was, the lab result was positive.
Here it is on there.
So I think sometimes country wells, sometimes maybe contaminated wells. At least we're looking for it.
Mm-hmm.
Thank you.
Mm-hmm.
Anybody else?
Can I just ask a question about how are things going in the jails? That's just,
Well, we went in and did another clinic. Is Robin Mauer here? Yes? You want to come up and speak to that? But a concern is that we were the source for the jail, community corrections, and the juvenile center to get their Binax rapid antigen test. And we didn't know that the state would send out an email on it, just like that and say, okay, we're now depleted and we don't expect to get any more. And so now we're scrambling to try to figure out where they can order tests, and then, of course, they now have to pay for them, so brainstorming.
I coordinate with Charlie Funk, the jail commander, and he will call and say, we have so many boosters that are needed for the Moderna. We normally take the Moderna vaccine in now. In the beginning, we took J&J, but we do not use that vaccine much anymore. We also go to Jabal for the children, and the juvenile, if they have parental consents, we'll go over there and vaccinate as needed. So, and then also Stephanie Blundell with Community Corrections will get a hold of us, and if they have the Community Corrections people that are in and out of the community, but they have to stay there, we'll go there and vaccinate too. So it's just like kind of on-call basis. They call and say, hey, can you come over and vaccinate? And we'll set up a date and we go into the Sallyport and we vaccinate. So trying to keep them vaccinated.
How many children at Jabal? I've lost track.
I'm not for sure. I know we did 12 or 14 vaccines this week at Jabal on Tuesday, yesterday, so just tried to keep the kids vaccinated, and 2 of them were boosters, so.
Even better.
And 1 of them was pediatric, so. All right, any other questions? Okay, thank you.
Thank you, Robin.
Vital statistics? Rita?
Brooke's going to step in. Brooke Bolts for Loretta.
Hello.
Hello.
So we're pretty much on a normal schedule. We're open to the public still. We have plenty of birth, plenty of death that are being done every day. You can see where our numbers are. So the death it's about the same as it was back in October, but we did see a little bit of a decrease in November. And birth, wow, October was a busy month. Yeah.
Light was on sale 9 months ago.
Exactly. And then, of course, on the next page, I added the fourth quarter COVID numbers to show you how many people from Vigo County have passed and how many out of the county that passed in our county. So the out of county are people that are considered a residents other than Vigo, but they still die in our hospitals or somewhere here in Vigo County. And of course, December was the biggest of those 3 months, so. And I do not have the numbers for nursing homes or long-term care with me. That's something I could compile and send you guys an email for. I have all that information, I just have to go through it. And a lot of people get sent to the hospice facilities or the hospitals when they pass away, so it's not necessarily listed on their death record. Any questions?
Thank you.
Thank you.
Thank you, Brooke.
Environmental, Amanda?
Okay, so environmental, the food and septic divisions have been staying completely busy. Since we're in the main office, fielding all those phone calls that are coming in about COVID, which I'll let Joni touch on that a little bit later, because we've set up a phone tree to kind of help calm those phone calls down so we can get our work done. We did complete our year. We were able to get both inspections done for all of our food establishments last year, which is yay, because haven't been able to do that the last year. Like I said, Rhonda and Steve continue to be bombarded with wastewater questions and improvement, location permits and that kind of stuff. Other than that, currently we are wrapping up licensing for our food establishments and our body art establishments. And we had about 10 late fees that we had to distribute because they didn't get their stuff in on time. Other than that, that's it. Any questions?
Very busy year.
Yeah. Yeah, and then the complaints started rolling in, our normal complaints, and we're like, what's going on? So, all right, thank you.
very much.
Thank you.
Vector control, Mike, please.
Good afternoon. I really don't have anything. We're working a couple rodent complaints, and we're doing our vehicle maintenance and repair. And that's about it for us right now, guys.
It's seasonal.
Yeah. Looking forward to another busy year. Any questions?
Mike, are you guys eyeballing any potential headaches for the spring?
Always. You know, I think we're going to have a bumper year of West Nile virus. We've had a very mild winter, and that's going to allow a lot of the QLEX to overwinter. So I look forward to a pretty busy season. We're starting out with our tar amnesty program, of course. Try to eliminate some of the potential breeding sites, but it's going to be another challenging year. We did finish last year with only 6 positive pools. And the state of Indiana had, 263 positive pools and 14 human cases. None in Vigo County.
That's good.
Yeah, so I look forward next year to be another bad year. Hopefully we won't be the first one in the state with a positive pool, but if we are, we are. That means we're doing our job and we're checking, so.
Surveillance.
Any questions?
Mike, is there an area of the county that has more positive pools than the other, north, south, east, west?
Yes, southwest.
Southwest?
Yeah.
Yep.
Yeah. And I could tell you why, but I won't tell you.
Yeah. I know the area.
Dr. Turner knows where I'm talking about. He's been there. Anytime you'd like to go out with us, feel free to give me a call, and
All right.
we can take you to the West Nile jungle,
Okay.
and we can show you what's going on.
All right. Thanks.
Any other questions? All right, thank you.
Thanks, Mike. Health awareness grant by Ann.
Ann is actually at the Second Missionary Baptist Church with Dr. Janie Myers giving vaccinations. But as you can tell by her report, she has been very, very busy. The grant that she's operating with is over $200,000. And one of the components that we have added recently is a contract nurse to go out and do the homebound. And we've got 98 of them on the list. That was a program that kind of fell through the cracks from at the level above us. And so we now have a program in place where we can more effectively do the homebound. But it has gone incredibly well. And that's a federal grant that ends June the 30th. It's to do outreach clinics. In fact, she organized another one that will be out at, I think, plumbers and steam fitters for 4 days, which will do testing and vaccinations.
Been very, very successful going out to the community, so she's doing a phenomenal job with it.
It sounds like, if I've been seeing it on social media, Dr. Myers has kind of done a few of these with her?
Absolutely.
Okay.
And how rewarding it is when they go into a church or in a place of worship and somebody who's been reluctant to get a vaccine decides to get it and the congregation cheers for them. So it's worked out really well. Right people in the right jobs, doing the right thing. And then I'd like to, if you don't have any other questions on that, I want to speak to the phone tree. Dr. Brucken witnessed it. We just became the catch-all for everything. It's like every single line at the health department was lit up all day long, and it just was totally affecting our continuity of operations. Somehow we're listed as the operator for the county, but then you compound that with all the people calling with quarantine questions, their testing results not coming back, you name it, it came in, and it was just awful. So our IT department worked it out where now if you call in, you'll hear an automated message that will direct your call to what it is you're looking for, whether it's vital statistics or a specific line that's designed for education for COVID, and Grant and Matt have been manning that. But that's helped us out tremendously. Also, in October, we received our 6-month reimbursement for the administration fee for COVID-19 through Medicaid and Medicare, and it came out to be $133,000, which is going to allow us with our COVID response. And Dr. Box issued a letter to all fiscal bodies telling them that it cannot be used to supplant our budget, but can be used for COVID response or to help increase our children's immunizations because they lag so far behind. But fortunately, we have a grant that already addresses that. Or she encouraged us to do like large, one-time purchases that we need, which would be like our Crown Vic?
Yeah.
Our 1994 Crown Vic that we take to conferences with the broken odometer that broke in 2013. So we're hoping we put in for an additional appropriation that hopefully we can get that. So that'll be helpful. It's going to be a higher amount last year's first 6 months because of the 2 doses. And then in the fall, our July 1st to December 31st is going to be your booster shots primarily. And then we should see that in about March coming through into our accounts. We also have an ISU public health intern, Emily Milton. She started with us yesterday, and she's going to work with Marcy Shaw on body art and social media. So that's going to be her project. And then I also have a medical student who's doing his master's in public health that's going to come and do his practicum with us. We really, at an overwhelmed time, usually don't take interns, but he told me that Dr. Randy Stevens had given him my cell phone number. And so with him saying that, I could not turn the guy down. Goes to show you. But that's kind of what's been going on in our world.
How about the website updates?
Okay. Beth Morse worked with our IT department on updating our webpage, making it more manageable for anyone to go on and get information, whether it's current local information or easily accessible to state information or CDC information, because it really wasn't very user-friendly. And we cleaned it up and took some stuff off, created a box at the bottom that would have, that'll have seasonal information in it, like what do you do in a storm, knocks out your electricity in the summertime, things like that, ticks, so people can go to that. We haven't really had, we haven't had any really good candidates for our public health educator, media coordinator position, so it's been very, very difficult to maintain our Facebook presence. But we figured if we could just, with that one-time hit, try to keep that information up to date on the website, it would work. So that's another thing that we have worked on.
Was there any citizens' input this evening? My colleague?
Would it be possible to write a letter of thank you or something for Dr. Myers? I don't know if the board would be in agreement with that, with all her work she's done with outreach. I'd be happy to draft it.
That'd be great.
Thank you. Put on a letter, that'd be good. And I wonder if Jimmy could give us a little update. As most of you know, Jimmy more or less runs the respiratory therapy department at Union, and so day in and day out, he's been on the front lines and looking at the numbers and so forth. And kind of what you've been seeing, Jimmy, could you give us a little update?
Sure, I can speak to it. I can't necessarily say I'm on the front lines
You're
anymore.
on the front lines.
But I'll tell you, this response in my area has been really amazing, and the resilience of the health care community and the nurses and therapists, physicians, nurse practitioners that are there every day is really amazing. We all really believed that this was going to end, and I think everybody kind of had hope that it was going to end. And since over the last few months, we've really noticed that there has been a lot of strain on our current employees. A lot of people are choosing to do different things, which is unfortunate, and they're moving out of healthcare into other areas. But there are still a lot of people out there with a heart to care for people, and that's what we all went into healthcare for, is because we want to care for people and nothing else. So if I could just for anybody who has young kids or people that are interested in what they are trying to think of what they want to do, we really need good practitioners, respiratory therapists, nurses, physicians, and we need local people to get into it, because this community has a lot of comorbidities, as the physicians can attest to, and everybody can attest to, and we're going to be caring for this community for a long time. And so it's still a very noble thing to go into healthcare. There's great programs locally, and there's great places for them to work locally and make a good living and raise their family here. And we just really encourage that. Right now we're in a staffing crisis because people are leaving the community, going to other places. People are getting sick, large groups at once, not like the first wave. This is 3 or 4 nurses from one unit will be gone. And so then you got to make up for that.
Right.
And so that just puts a strain on patient care, puts a strain on every aspect of it. The other clinicians, the care is not as good, unfortunately, that we want to provide. And so we're looking at alternatives right now. I know that specifically unions looking into investing in IV Tech to really booster the amount of clinicians coming out of there. And that's really for our community. So I just want to take the opportunity to, if anybody is on the fence about going into healthcare, this is the time to go. And you're really needed. And you really will be taking care of my parents and me and my children at a later date, because, I mean, this is, our community really needs those people to step up. So that's all I have to say.
Thank you.
Thanks, Jimmy.
Yep.
When you look at at least the numbers from Union, we're, over the last several weeks, averaging around 60 patients admitted for COVID, 10 to 14 on ventilators. The great majority, though, like everyone has said, is that, are unvaccinated people. There's been a few, very few on ventilators who've been vaccinated, but they've also had some other comorbidities, may have had a lung cancer or some other complicating medical problem. So amazingly, the other thing we thought was going to happen, at least in my office too, was that once family physicians had vaccines in their office, we were going to see a nice uptick in how people would respond to that. I have not seen that. We have all the vaccines in our offices, and we're all set up for it. There's no charge for it. And we daily, everybody comes in, we ask them, maybe a couple people a week that I've known for years, will get vaccinated. So that was one thought, boy, your local guy that you've known, he's recommending this for you. Give us it's not the state, it's not the government, it's a guy that lives here in town with you. I've not really seen that. I don't know if that's anybody else has, but surprisingly.
Linda, do you want to share with what you're seeing that's coming in? Is it primarily booster? Do you get new people that are doing a first dose?
Yeah, we're not seeing very many people that are coming in for first or second dose at all. I can say that within the past 2 weeks, I have done 1 first dose, no second doses. They're all boosters. Yeah.
We're not impacting that population. We're still 51% or something. But
right.
Lower half in the lower part of the nation, not good. And I don't know what it takes. People are sick. People are sick. They're dying.
I just reviewed actually a very large international study about a week or so ago, where they traced through 1.2 million fully vaccinated and boosted people that still tested positive for COVID, and they looked at their death rate. So for every 10,000 people that are fully boosted and vaccinated that still tested positive, they had 0.3 deaths per 10,000 people. So, and if you look at that across the other spectrum of that, people that continuing to die at that rate, over 10,000 people, it's 697. So 697 versus 0.3 if you're fully vaccinated and boosted. And that's over 1.2 million people studied internationally. So I mean, numbers like that, and and that's a consortium of people that looked at this. This isn't one guy's study from Johns Hopkins or anything else. I mean, it's just jaw-dropping the numbers and the sheer effect of how that vaccine and booster can keep your butts alive, and yet there's still such resistance out there to take it. It's unbelievable.
And COVID's not influenza. You don't always walk away from it in 5 days. Still taste and smell for many people, which is dangerous, does not come back. Pulmonary fibrosis, which is you're a pulmonary cripple for the rest of your life. Myocarditis, shortness of breath, can't go back to work, brain fog, confusion. These are long-lasting, these are long-hauler symptoms for a lot of people that destroys your life. It's not this simple influenza, and you're okay in 5 days. So.
From a human behavior piece, what I keep hearing now is, for some reason, something's spreading that everyone just needs to get it. And then it'll be, and I keep hearing that repeated now. It's almost like the reason for not getting vaccinated. And I'm just, it is interesting, the reasons people come up with. It's like, well, we're just waiting for everybody to get it. So, I don't know.
But that's it. It's not the flu. It's not simple.
And that's, and it's like, I don't know what to say to that. I don't know what the campaign is against that thinking, obviously, besides their family members experiencing these things.
Mathematical march towards herd immunity is what everyone lays it on. The problem is it is a very dangerous game to be playing, to go out and get yourself purposely infected. This isn't chickenpox from 1967 where you have chickenpox parties. So,
well, and herd immunity, like, what's the death rate in that? That's what I'm thinking, so.
Exactly.
Yeah.
And the rho value, the R naught value for Omicron is ridiculous compared to Delta. And so our herd immunity, we used to talk about 68% for Delta. So if we get to that for people that are vaccinated and recovered, we're at herd immunity. It's well over 95% for Omicron because of the infectivity ratio. So we're never going to get there just by having people just go out and get sick. It compounds to it. And meanwhile, those of us in healthcare and those of us watching our family members suffer through it, or the ones bearing the brunt of it. So, and as Jimmy said, and Dr. Turner said as well, there's no end in sight. We're not looking 2 weeks down the road saying, boy, if we can just make it to February the 4th, we're going to be golden, because we're not near the end of the tunnel to see the light.
Anything else? Anybody? Motion for adjournment?
Motion for adjournment?
Second?
A second.
All those in favor? Aye.
Aye.
Opposed? Meeting is adjourned. We'll meet together again April 20th. Thanks, everyone.
Thanks, everybody.
Thanks.
Thank you.
You need me, sir?
That's all right. Yeah. Always good to hear this.